Hello, everyone. This is Free Little, your host of Simply Free Little Talk. And I have a special guest today. My guest is none other than the amazing, incredible, wise Dr. Kenya, who's going to bring us some very important information for our health. Health matters are extremely important. And so she's going to bring a tip to us so we will know and be more aware of colon cancer. Hello, Dr. Kenya. How you doing?
Hello, Free. So good to see you.
Yes, it's my pleasure for you to see me and for me to see you. But more importantly, I guess want to hear from you, Dr. Kenya.
Well, Free, I have some really important information today. I
Yes,
need
you
to
do.
talk to you and your guests about colon cancer.
Oh, yes. Share. Do share.
So, you know what, Bree? The reason why I love talking about this, Free, is because colon cancer is so preventable and it's so treatable. Did you
Wow.
know that just like eating your fresh fruits and vegetables makes the biggest difference? Can you imagine that?
Vegetables, just eating green leafy products can change our outcome.
Hello, yes.
Wow.
Yes, and you know why?
Do share. Share. I'm excited. Now I'm on the edge of my seat.
Okay, okay. So you know how like when you're washing dishes, sometimes you get that Brillo pad so you could do an extra scrub.
That's it.
Okay. So when we eat our green leafy vegetables, they
Yes.
act like a cleanser. They go through our colon and it helps with cleaning things out. That is a
Wow.
part of how we do it. Now, when we eat a lot of fat, then Free, guess what? That stuff clogs things up. Think about it
Mm.
when you're washing dishes, okay? If you've got a pot that's got a whole or a skillet that's got a whole bunch of oil in it, you don't let that go down your drain.
Not at
You
all. It clogs it up.
Yes, honey,
Oh,
yes. And so you get your little can, right? Your little oil can, and you pour your oil off in there, or you scrape it into the trash. But you surely don't pour it down your plumbing. So why do we do that to
mm.
ourselves?
Wow, that is something to think about. Ooh, we do that.
Yes, yes. And so, people who have a really high fat diet, they are setting themselves up for colon polyps that can go on to become
Mm.
colon cancer.
So polyps are very well, we can prevent having colon cancer by monitoring what we intake.
That is correct. And so some people might be asking, well, what's a polyp? Can you
Yes, share.
see this right here? Can you see this?
Go to your right
Okay.
and then back to your left, and that way we can see the picture again. So back to your left. Perfect. Right there. We can see it perfect.
All right. So, what I want you to see with this is that these little polyps, okay,
Mm.
can get bigger and bigger and bigger until they become actual cancer. Okay.
Oh,
These polyps, they start out like little skin tags inside of our colon. But
mm.
when we eat lots of vegetables, okay, it helps with cleaning our colon so that you get less of these. All
So
right.
green leafy vegetables, like you stated earlier, are more of a
Mhm.
sponge to keep us cleansed.
That's right.
Wow.
That is right. And then for us to avoid clogging up our plumbing by eating so much of the oily foods. Now, of
Mm.
course, there's other things that put people at risk for colon cancer. So, like some people, they actually have a family history of it. Okay.
Family history.
So, Free, if somebody has a family history where a person like their dad, their uncle, their aunt If any of those folks had colon cancer, they need to ask them what year they got diagnosed,
Hmm.
okay? Because then you're supposed to start screening at least 10 years sooner,
10
okay?
years.
Yes. So let's say that person got diagnosed with colon cancer when they were 30. Then their family members need to start getting screened when they're 20.
That's really interesting. So we need to look at the 10-year difference of the
That is
diagnosis.
correct. Now, the American Cancer Society says that for people who do not have a family history, then you start at the age of 45.
So age 45 is the starting point of getting annual examinations.
Now, that brings us to another question, okay? Is how often? Okay, so
How
we're going to come
often? Yeah.
back to that in just a moment. Let's talk about one other condition. So we talked about if there's a family history, okay?
Yes.
The second thing would be if you have a personal history of ulcerative colitis.
That's interesting. I never knew that. Please do
Mhm.
explain that.
So, ulcerative colitis is where people get these ulcers in their colon, okay? And they're horrible. It makes them have just massive diarrhea and inflammation. It can be very debilitating, okay? People who have that condition are more prone to getting colon cancer, and it's
Mm,
irregardless of how they eat.
irregardless. So
Irregardless.
is there a root cause or it's still undetermined because like you stated, it can happen whether they eat certain foods or not.
So, ulcerative colitis is in a class of conditions called inflammatory bowel disease. That is
Um,
not to be confused with irritable bowel syndrome. So, audience, it is not irritable bowel syndrome,
Thank
okay?
you for clarifying that because that was my next question. Thank you for clarifying that because that
I
was
can
my first thought.
see
Thank you.
I can see people getting worried, okay?
Yes,
Like,
I
"Oh
was
my
like,
god."
yes, I was like, what
So,
is that the same? Thank
there
you.
are two types of inflammatory bowel disease, okay?
Ah,
One is ulcerative colitis, the other one is Crohn's. It is ulcerative colitis that specifically can make you more prone to colon cancer.
thank you for this information. This is golden. This is golden.
Okay. So
Mhm.
then you said, well, Dr. Adam, how is it that that or when is it that we should start screening? So first off, let me help you to understand another reason why it's so important. Okay, in America, it is common, the third most common cancer amongst men and
Mm,
women.
the
Okay,
third.
the
Wow.
third. When caught early, you have at least a 5-year survival rate. And caught early enough, you can live out your regular life.
That is great. That's great news.
Okay.
That's great news.
So now let's talk about the ways that we can test. Okay. So the simplest way and the cheapest way is a stool card, okay? Literally, it's just a little piece of cardboard that we have a special stain on, and we ask the patient to put a stool sample on there, okay? That is called a fecal occult test. Now,
Mm.
the key about that, okay, Free, the key about that is it's very dependent on what a person has eaten within 24 hours of their test.
So just
Okay.
within 24 hours. But this is
That's
also
correct.
dietary that we need to be more cautious of what we're intaking.
Exactly. So
Thank you.
if a person is doing the hemoccult stool test where they're just given those cards,
Yeah.
okay, they can't eat beets, they can't eat red meat, okay, there's a whole host of things that they cannot eat within
Mm,
those 24 hours of that test. And they've got to get their sample on 3 different days, okay?
interesting.
hmm So now, when they do that, okay, when they do that and they put their date, they put their name on it, then they're going to turn that into the lab, okay? Again, it only costs pennies free.
Yes.
Pennies. I'm talking like less than $5 for that test to be run.
And so, where are the facilities that we can go to for such an inexpensive testing?
They they can go to any primary care facility to
That's
have
good.
this done. So anybody that is a family physician, internist, they could go to a free clinic. Okay, they are widely available. And once they do that, they have to understand that they're going to do that once a year to truly be screening for colon cancer, because what it's going to pick up is blood. Okay. Now, there's another type of stool test. That one is called a FIT, FIT, FIT test.
I've heard of the fit test. Please explain it. Yes.
Okay, so the FIT test is a little bit different than the hemoccult test. It stands for fecal immunochemical test. What's the difference? Okay, the difference is that this one, it does not depend on what food you've had. It's not, you can eat whatever you want,
Okay.
okay? It is only going to pick up blood.
Only will pick up blood.
Yep. And it will not be confused with hemorrhoids. Okay. So, you know how if people have bleeding hemorrhoids?
Exactly.
Okay. It's not going to be confused by that because it's literally picking up blood that has been broken down by the digestive tract.
This is
Is
so
that not
interesting.
cool? Isn't
It
that
is.
so cool?
It's amazing that this just the information that you've provided. I feel like I have some knowledge now that I did not previously have. So thank you. Continue, please.
Okay.
I'm getting
So,
excited.
those are the
Wow.
least expensive, okay? And you do it every single year. You could do it in the comfort of your home.
Mm,
If it comes back positive for blood, then you go for your colonoscopy, okay? All right, so there's that. Now, let me tell you about another type of stool test. This one's called Cologuard.
Holy God. I
Okay, so
like
you
your
know how,
kid.
yeah.
I see your kid. Yes.
You
Cola
know
guard.
how, like on the commercials, you see the little guy that's smiling
Yes.
when he walks in. Okay. So when your doctor has to order this for you,
Okay.
okay, then the company will send you this kit. You open it and you take your contents out. Okay. And once you've
Pretty big
done that,
plastic container.
okay,
Yes, I
yeah.
see.
So what you'll see when you open it is your cards, okay? And
Okay.
on this card is very, people sometimes forget this. You absolutely have to put the date and the time, okay? Because if you take longer than 24 hours to send this back in, then it's an invalid test.
Okay. So we have 24 hours.
Yep. Okay.
Time
So
sensitive, everyone. Listen
that's
up.
right.
Listen up.
The next thing they take out is a device that looks like this.
Is that plastic? Okay.
It
Yes. It's
is,
bending.
yep. And
Yes.
it goes inside of the toilet seat. Okay.
Okay.
And they have their container.
Okay.
Okay. And so the container goes on like this underneath the pot.
Yes. I
Right?
see that.
And they would just take the top off. Okay. And then be able to allow the fecal matter to fall inside.
That's pretty neat.
It is. It
Yes.
really is.
And you're
Okay.
not making a mess at home.
Not making a mess. Okay.
Modern technology.
Then the next thing they do is they take this little tube.
Mm-hmm.
Okay. And it almost looks kind of like whiteout.
Yes.
It looks kind of like
It
that,
does.
doesn't it?
Like a huge container.
Exactly.
Yes.
Now, they don't just go dipping this into the fecal matter. They literally just wipe across it.
So like a
Okay.
streak right across.
Yes, exactly. And then they put this back inside of here. They close it
Okay.
up, put it in here. Then they take this liquid. This liquid is what helps to set the stool. Okay.
Mm-hmm.
They pour this into the container. 1 second. Okay. So the fecal matter would be in here. Then they would pour this liquid
Yes.
into here. They would close this up, put it back into the bag, put it back into the box, and seal it up and send it back.
It's that simple.
It's that simple. It's
Step
just
by
that
step
simple.
within
Now,
24 hours.
within 24 hours. And Bree, the cool thing is that is a two-part test, okay?
Okay.
It's looking for DNA and it's looking at blood, okay? So it's a two-part test, which is why a person can do this, but in order to be screening appropriately, they'd have to do it once every 3 years.
That's interesting. So the good thing is you have just explained to us in less than 20 minutes several tests that are available that are less than $5. We can do at home. We can go to any free clinic. We can go to our own private doctor. Any family medicine clinic will have all of what you've just explained to us.
That is correct.
Wow.
That is correct.
But
Now,
yet, doctor, can you, why
yeah,
do we avoid getting this assistance?
Free, the only thing I can think of is lack of knowledge, one.
Absolutely. I,
Okay.
I, I totally concur with that. Yes.
Two, people tend to feel invincible until they start having things go wrong. Okay.
That's good.
It's like,
Good point.
it's like they think, oh, that's their problem, not mine. Or, oh, I'm a good eater. People assume that just because they are doing the right things, that bad things won't happen to them.
Sure.
Yeah, your chances of something going wrong are less, but it's not none.
Yes.
It's not none. And so the fact of the matter is the Western diet is very high in fat. And because it's so
Yes.
high in fat, this particular cancer has been rising. It's gone up 50%. 50%.
50%.
Yes.
50%, Dr. Kenyon?
Yes. And the other thing that's going up is liver cancer.
Liver
I've had
cancer.
so many people that have fatty liver disease because of their high fat diet or because all these crazy toxins that they take into their body. All you alcohol drinkers, if you are actually abusing alcohol, you need to ask yourself, okay, let me go online Let me look up what a serving is. Let me
Yes.
look up what's
Mm.
considered normal drinking.
Normal intake,
Yes,
one
because
serving.
once you look at that, then you can really check yourself. All right. A serving isn't going to cause you problems. It's
Mm.
the people who are drinking in excess. They damage their liver, and
Mm.
then they may be taking other drugs, or whether they're prescribed or not, that's damaging the liver. And then they eat this
Yes.
really like fatty food, and they end up getting fatty liver disease, which later on can
Mm.
become liver cancer. It
Oh.
is really high in Northeast Texas, liver cancer.
That's
But I
interesting. That was a geographical location
yeah,
indicator of a high rate. Does
yeah,
that
for
mean that we're
Texas,
drinking
the
more?
higher rate, huh?
Are we drinking more in that geographical area?
Yeah, there's a lot more rural areas in
Mm-hmm.
Northeast Texas. And of course, in rural America, you've got a lot more alcohol intake. That's just a fact. And so that's even across the nation, any place where there's a lot of drinking. Now,
That's
there's
interesting. Good
one more
studies that you're
type of
providing.
test. So the other way that we can screen for colon cancer, and yes, it is expensive, okay? It's
Okay.
also invasive, is what would be called a colonoscopy. Now, I don't have a
Okay.
colonoscopy with me, okay? It's
Okay.
called an endoscope.
Yes.
And so I want to show you that the tube is only this thick.
Mm.
Okay, you see that? And it's flexible, okay? Flexible. This tube would have, instead of a stethoscope at the end,
Yes.
it would
We
have
don't have a stethoscope inside of us. I love that. Thank you for
it would have
explaining
a
that.
light at the front of it, and then it has a little device that can shoot out. It's called a snare to take a biopsy if needed.
That's inserted
Okay.
inside.
Yes, it's
Yes.
inserted inside of the rectum. It goes all the way up, and in order for them to get to where they're going, they have to blow air into you. So they distend your colon so that they can see.
And there you have it. That's your colonoscopy experience.
That's your colonoscopy, and that's only has to be done once every 10 years.
Once every
So
10
the
years.
beautiful thing about that is that once you've done it, they've looked at your whole colon, the
Mm-hmm.
whole thing. If they see a polyp, they take it off right away, send it off to pathology, and voila, they know what it is and
Mm-hmm.
what needs to be done.
Mm.
That's simple.
That simple.
That's simple. Now
Preventative
it is
measures,
expensive though.
preventative measures that are not that expensive. Even a colonoscopy is still reasonable, and it's worth it for you to remove polyps as well as to just see if it's cancerous. Is that correct?
That
Am I
is
safe to say
correct.
that? Thank
Yes.
you. Yes.
Yes. Yes.
You have really given us a wealth of knowledge, a wealth of knowledge. And it's also informative so that others that have, yeah, intentionally avoided going to see the doctor or just don't want to know, because we have those individuals that say, I just don't want to know. If it happens, it happens. But you just explained to us that there are preventative measures, there are testing that's $5. And in some clinics, they may possibly even free.
Yep. That's right.
Oh my goodness.
That's
So
right.
colon cancer is preventative. It is a way that we can prevent us going through having those issues, those challenges.
That is
Mhm.
correct. Colon cancer screening
Yes.
is inexpensive. And the thing is that left untreated, free is so sad, because think about it. We've got a lot of intestines,
Mm-hmm.
okay? And it's got a lot of blood supply, it's got a lot of lymphatics. So when you hear people say, oh man, they opened them up and cancer was everywhere, so they
Mm.
just closed them up.
I've heard that. I heard that.
I know, right? I used to hear that too. I'd be like, what do you mean? And it's
Yes.
because with colon cancer, it can spread so far, so many places.
Dr. Kenya, explain the length of a normal large intestines and then, of course, the small intestines. So you can kind of help medically explain why people have used the terminology of they open them up and it just spread all over. And because you said it covers such a mass, but please explain the depths and the length of an intestine.
Okay, so basically, your intestines, the whole thing, the small intestines all the way to the large intestines, is generally from the top of your head to the bottom of your feet. That's how long.
Wow.
Okay. So, top of your head to the bottom of your feet. Now, it's all nicely tucked away for us,
Yes.
okay, between here. This
Ah,
whole area,
can you
okay?
imagine?
Yeah. And then the large intestine starts from over here. It comes up, it goes across, and then it comes down. So when people talk about, oh, I've been so constipated or I'm really crampy, that's usually because of the transit through the colon,
Mm,
where the colon is trying to move it through. But if people aren't drinking enough water, then again, it gets sluggish. It's hard for it to move through.
that's something to think about. I'm just imagining you're standing and you gave us a great illustration of where our large intestines begin, how it travels around and then down again throughout the body, and then the length of it is as tall as we are. Can you imagine? I'm 5'8", so
Mhm.
that means my large intestine is actually 5'8" of a
No, no,
height.
no, no, no. I don't mean to say that.
Oh, okay. I was like, is it that long?
The large
I'm
intestines
exaggerating for the audience.
with the
Okay.
small intestines, the large intestines plus the small
Yes,
intestines together.
together,
Okay.
collectively, guys. I'm just being a little
Woo-wee.
facetious here, but I'm just saying because I'm 5'8", and so if she said it's that long, but we really do need to know that it is pretty extensive. And I know it's not that long. My daughter actually had the moration. What is it? More motor something, and you may know that term where they actually have to go inside of your body and turn the
Oh, she
intestines
had a
and
malrotation.
now
A
rotation. I was trying to call
malrotation.
it a motor road. I gotta stop joking. I know she didn't have a molar road, but I was mal rotation. Yeah, you gotta have
Yeah.
fun even with medicine. But actually, you really have given insight, and medical. I just didn't like blood. Every time you were speaking of the blood, I said, "Oh my God!" Every test had to go back to what's in the blood. But then I thought biblically, everything is identified in the blood.
Yes,
So
it
that
is.
gives me
Yes, it
comfort. That
is.
gives me comfort. Yes,
Yes,
but no,
yes,
but
it
you made
is.
it very interesting. It wasn't boring. You gave us a visual. You made us laugh because I said, "Okay, is it as tall as I am?" But I knew you. Actually, you did say that. I'm really being caught, a little sort of facetious, but also comical at the same time because you really did explain it. You said it's both. It's a combination of the large intestines and the small together. You did say that.
Yes, yes,
I'm just
yes.
trying to see a large intestines that's as tall as I am.
Ooh, that would be a lot of poop.
I would hate to see the person that has that
That would be
intestine
a lot of poop.
a whole lot. But that's like a giant then, if that's the case.
Woo.
Yes, you did so amazing. But I'm excited to share with the audience that when you return to Simply Free Little Talk, you're going to share with us about what over 50?
Sex.
Sex in the city, sex in the country, sex in the United States and abroad. But no, on a serious note, she will come back and share the precautions of being careful, protecting your body. I love that you're very informative in regards of safety for our bodies and our health as overall, and that there is a way that we can enjoy sex, but be safe 50 and over. So thank you so much for coming on. You have made me understand colon cancer and also get a laugh, but at the same time, the the seriousness of this type of topic, you brought it home. You brought it home to a place that we don't have to run in fear, and
Right.
that what we need is readily available for us, and it's not as expensive as we have been, told or we were led to believe.
That's
So
right.
thank you so much, Dr. Kenya, for coming on. And I do appreciate you coming back soon so that you can talk to us about the safety sex after 50.
All
So
right.
thank you for joining us. I'm going to go ahead and let you sign off. I'm going to tell the audience, get ready for your return. So thank you so much again, and looking forward to that topic. So, thank you, audience, for tuning in. Dr. Kenya, she's amazing. I mean, she has a wonderful personality, a sense of humor, and she also is someone who really is very detailed in letting us know that it is not an expensive process of going to treat, I mean, to for precaution, but also the safety measures that are already in place for us, the testing that's available for us, but more importantly, you need to take care of yourself. Eat more green, leafy vegetables. She said, cleanse your system out, and this will avoid you with dealing with cancer. And now she said 50%, that's a very high number. So, with that being said, I do want you guys to take the time and go and get yourself tested. Go. She shared with us all the different various tests that are available right now. So, with that being said, I want you to take care of your health. That's why we're doing these health sections, and get ready for sex after 50 on the Simply Free Little Talk. Thank you. Have a wonderful day.